What is blood pressure? Blood pressure, also known as BP in simple terms, is the force that the heart exerts as it pushes the blood around the vessels of the body. Blood pressure is generated by the strength of the heart's pumping action and is partly caused by the resistance of the blood vessels to the flow of blood around the body. In other words, blood pressure is basically the force pushing on the arteries by your blood as it passes through them. Someone with high blood pressure has blood that is pushing higher than normal pressure on the arteries. This puts more stress on the body. Hence, the heart has to work so hard to get the blood pumped through those arteries that it can actually enlarge and damage the heart, eventually causing a heart attack, stroke, aneurysm, and other heart problems if left untreated. A person's blood pressure level is expressed by two numbers. The upper number is called systolic level. The lower number is called the diastolic pressure. These two numbers are usually written with a slash in between. For example, you might see the numbers written like 120/80. Another common reading made to be 161. The systolic number represents the maximum heart reaches when it is contracting. The diastolic one represents the relaxation state of the heart just before it begins the next phase of pumping. For most healthy adults, the upper number falls somewhere between 90 and 120. The lower number, the diastolic blood pressure number, falls between 60 and 80. According to current guidelines, the normal BP level is around 120/80. Any blood pressure higher than 130 or higher than 80 is said to be slightly high. A blood pressure reading higher than 160 or higher than 90 is definitely high. If you have high blood pressure levels, then you are at increased risk of developing heart disease, kidney disease, hardening of the arteries, stroke, or heart attack. Do you have high blood pressure? Do you have low blood pressure? This is an important question for your health and your life. Why? According to the American Heart Association, AHA, about 1 in 3 adults in the United States have high blood pressure. And only about 63% of those with high blood pressure are even aware that they have it, causing a heart-wrenching of almost 60,000 Americans dying each year of complications related to high blood pressure. So what are the symptoms of high blood pressure? Unfortunately, the reason so many people don't know they have high blood pressure, also known as hypertension, is that there aren't really any clear symptoms of hypertension. However, some high blood pressure sufferers complain of frequent headaches and dizziness. Therefore, it is important to monitor your blood pressure regularly. And if you know your blood pressure is too high, you can do something about it today. Causes for high blood pressure. There are numerous causes, but here is a list of the major ones. 1. Heredity. If your parents had high blood pressure, you are at risk. 2. Race. African Americans are most at risk. However, all ethnicities are on the rise. 3. Gender. Men are more likely than women to have high blood pressure. 4. Age. As you age, your risk of high blood pressure increases. Salt intake. Sodium intake has been linked with high blood pressure sufferers. 5. Obesity. Being overweight is a huge risk factor for high blood pressure. Smoking. Smokers will oftentimes be more at risk for hypertension. A sedentary lifestyle. If you are required to sit a lot in your profession, your risk rises. What is low blood pressure? Low blood pressure is a different kettle of fish. It tends not to cause any lasting damage to the blood vessels. But it does sometimes cause symptoms or signs because the flow of blood through the arteries is not sufficient. The body depends on blood to get oxygen into vital organs like the brain, heart, and kidneys. If the blood pressure is too low, these organs might not gain enough blood. Unlike hypertension, we normally define low blood pressure in terms of the symptoms. Low blood flow and not usually like any specific number. An example of this is that someone can have numbers of 90-50 and feel entirely well, while another person will have the same numbers but be unable to rise from a chair or their bed. A natural cure for high blood pressure. Due to the seriousness of hypertension, doctors do have medications for sufferers, including diuretics, beta blockers, ACE inhibitors, alpha blockers, and vasodilators. However, here is the shocking part: as well as costing hundreds to thousands, many of these medications could have the following side effects. Kill nutrients in the body, risk of asthma symptoms, speed heart rate, depletion of taste, rashes, cold symptoms, kidney problems, headaches, nausea, weight gain, and growth of hair. Not pleasant. Besides, I thought they were supposed to help hypertension sufferers? Now the good news. There is an all-natural treatment for high blood pressure. Yes, you can drop points off your blood pressure reading in days. Doctors would agree there are numerous non-pharmaceutical things you can do to lower your blood pressure. Start with these. 1. Educate yourself. Most people hate studying, but we're talking about your life. Look for more information on lowering your blood pressure. 2. Lose weight. What are ways you can be more active and cut a few calories each day? Jump on the scale in 1 week and you might be surprised. P.S. Your blood pressure will drop too. 3. Lower your salt intake now. Lower your salt. Lower your blood pressure. 4. Get enough potassium. Eat foods rich in potassium including bananas, vegetable juice, potatoes, citrus fruits, and fish. 5. Take those calcium pills and eat that low-fat dairy. This mineral is proven to help the cause of lowering blood pressure. 6. Pack in the fiber. Any fiber is going to be helpful for clearing out the excess gunk in your body and keeping the blood pressure normal. Switch to whole grain foods whenever possible. Finally, don't stop here. This is just the tip of the iceberg for getting your life back to normal and lowering your blood pressure. Thanks for watching. Subscribe, like, and share.